Breast cancer is the most common cancer in women, but men too can be affected by breast cancer. Breast cancer arises when cells in the breast tissue lose control of the normal cell life and divide and grow faster, forming cell lumps called tumors. Tumors that stay in the breast are called benign. Tumors that acquire the ability to spread to other parts of the body are called malignant or cancerous. The most common type of breast cancer in men is invasive ductal carcinoma. It grows in the ducts and spreads to other parts of the body. Breast cancer can also arise from other tissues in the breast, but such cancers are very rare in men. Approximately 1 in 100 of all cases of breast cancer, including cases in women, occur in men. The cause of breast cancer in men is unknown, but some factors may contribute to this development. Aging, inherited or spontaneously occurring defects in specific genes, and medical conditions leading to unbalanced female and male hormone levels in men can induce cells in the breast to grow and divide faster than usual. Cancer may change the size and/or shape of the breast. A lump or a thickening in the breast or armpit may be felt. Skin covering the breast, nipple or areola may show dimpling, redness, scaliness or puckering, or look like orange peel. The nipple can discharge liquid or turn inwards. The presence of these symptoms may not be related to breast cancer. It is also possible that a person with breast cancer will not show any of these symptoms. Several tests can be used to diagnose breast cancer. A clinical breast exam can be carried out to investigate the breasts and areas under the arms or lumps, thickenings, or anything else that feels or looks unusual. A mammogram uses X-rays to examine breasts for abnormalities. During this test, the breast is placed between two plates in the machine and exposed to X-rays from different angles to produce images from the inside of the breast. However, a mammogram is not able to distinguish between cancerous and non-cancerous lumps, and further tests may be needed. Ultrasound is a procedure that uses high-energy sound waves to examine breast tissues. Breast ultrasound can distinguish between solid masses, which are likely to be cancerous, and those filled with liquid, which are most likely non-cancerous. If imaging tests suggest cancer, a doctor will advise you to have a biopsy. This is a procedure which removes small amounts of tissue from the breast or lymph nodes for evaluation under a microscope. There are 4 types of biopsies. A fine needle aspiration biopsy removes fluid from the lymph using a thin, hollow needle. A core biopsy removes a very small piece of tissue from a suspicious area using a wide, hollow needle. Surgical biopsy removes all or part of the lymph and the surrounding tissue. A lymph node biopsy uses a needle to retrieve tissue. Biopsies allow for establishing if cancer has spreaded inside the breast and/or to other parts of the body. Stage 0 cancer is a very small, localized cancer. Stage 1 cancer may have spread to the nearest lymph nodes, where only a small number of cancer cells are detected. Stage 2 cancer has grown but is still inside the breast or has only spread to the closest lymph nodes. Stage 3 cancer has spread to the lymph nodes and/or to the chest wall and/or skin in the breast area. Stage 4 cancer can be any size and has spread to other parts of the body, including the lung, liver, brain, or bones. Breast cancer can be divided into different types according to the presence of certain proteins called receptors on the cell surface. If cancer cells have receptors for female hormones, estrogen or progesterone, breast cancer is known as hormone receptor positive. About 80 to 90% of breast cancers in men are hormone receptor positive. Human epidermal growth factor receptor 2, or HER2, is another receptor which can be present at high levels in some breast cancers. Such cancers are called HER2 positive. When a cancer has no estrogen or progesterone receptors and normal levels of HER2, it is called a triple-negative breast cancer. The treatment of men with breast cancer is usually selected based on the stage of the disease and the type of cancer at diagnosis. The main treatment types for breast cancer in men are surgery, hormone therapy, and chemotherapy. Other therapies include radiation therapy, also called radiotherapy, targeted therapies, and immunotherapy. Surgery is the most common type of treatment. Depending on the amount of breast tissue removed, it is called lumpectomy, breast-conserving surgery, or modified radical mastectomy. About 98% of men with breast cancer are treated with mastectomy. Hormone therapies are used in men whose cancer is positive for estrogen or progesterone receptors. In these men, treatment with these therapies can slow down cancer growth. Hormone therapies can block the effects of estrogen or progesterone on cancer cells by targeting receptors and blocking their interaction with a hormone. They can also lower levels of estrogen or progesterone by blocking their production in the body. Chemotherapy drugs are usually injected into a vein, but may also be taken as tablets. Once the drug enters the blood, it can reach cancer cells in any part of the body. Chemotherapy is usually given in 2 or 3 week cycles, depending on the drug, and such treatment may last from 3 to 6 months. Chemotherapy can be used as a neoadjuvant therapy before surgery to shrink tumors, or adjuvant therapy after surgery to prevent cancer coming back. Radiotherapy uses high-energy X-rays or other types of radiation to target and kill cancer cells. It can be used before or after surgery to increase the chance of cancer not coming back, and can also be used when tumors are large or have spread to the lymph nodes, the bones, or the brain. Targeted therapies recognize and block specific molecules in cells that cause cancer cells to grow and divide. The type of targeted therapy given to a person with cancer will depend on the type of cancer and the specific molecules found in cancer cells. Immunotherapy stimulates the immune system to recognize and destroy cancer cells. Survival after initial diagnosis with breast cancer of the same stage is similar for men and women. Breast cancer in men, however, is often diagnosed at later stages. This affects the success of treatments, as more advanced cancers may not respond so well to therapies. The overall 5-year relative survival rate for male breast cancer in the US is estimated to be 82%. It is 95% if cancer is found only in the breast, 83% if cancer is detected in the regional lymph nodes, and 19% if cancer has spread to other parts of the body. Several factors such as age at initial diagnosis, general health status, breast cancer stage and type, and how well the treatment works can influence the survival rate. Videos are also available on a number of different topics on breast cancer.